And if we take a case study of a client of ours who, 34,000 employees, which is now down to sort of 20,000. So they went through a dramatic sort of change process. And initially they wouldn't allow us to use SilverCloud because they thought it was not good when they got other apps and other providers in place that offered sort of mental health support. But over time, with the data that we produced for them and showed them the stats in relation to the underlying risk factors, both in terms of the psychosocial factors, but then also things like the excess weight, inactivity, poor sleep, suboptimal nutrition, and all of those factors that SilverCloud also address, then it's enabled us to show the data and then introduce it initially as part of extending a healthcare plan for everybody. So the money that we've been able to save in actually sort of managing their programs across the ones that I've mentioned, we were able to save them initially sort of like 6 million in inappropriate sort of referrals, over sort of 18 million initially in the sickness absence side. And that was sufficient for them then to invest that money to actually put a healthcare plan in for everybody. And then as part of that, we also said, well, if we can use SilverCloud as part of our stepped care model, so literally to use it as self-help, for guided self-help, but also support people with practitioners when they're having CBT or they're having physio or they're talking to a nutritionist and working with a nutritionist, then SilverCloud could support that. And I think we get far better outcomes by using that than in isolation. And then thirdly, what we looked at is just introducing it as a wellbeing program. So we offered it to all employees. I think they were absolutely amazed by what they could actually get out of it. And what we found is by introducing it as a wellbeing tool, then people can actually go, oh, hang on a second, I recognise that. And they can work with our wellbeing practitioners, and we can actually guide them to actually start making improvements and taking control of their own health and wellbeing, in the hope that that will reduce the risk of them becoming ill and needing, either surgery or, some form of intervention, which is neither good for them or their organisation.